Hello and welcome to Mommy Dentist and Business Podcast. I'm your host, Dr. Yum. Welcome back, everybody. And I am really just excited for today's episode, but I also want to say thank you to all of our listeners and followers because of your participation in our community and our listenership. We always rank in every year the Dental Woo podcast, I guess rankings, if you would call it that, as fan favorite. And I want to say thank you because without your help, we can't do that. We are downloaded in over 44 countries, and we are just amazed by how many people tune in every week. Now, today's guest, she's also a mommy dentist, and you may see her on Instagram. Our guest is Dr. Joyce Kahng, cosmetic and restorative dentist. And guess what, you guys? She has over 297,000 followers. So if you're not following her, go over to Instagram and hit the follow button. She's got great content and you're going to learn so much. And probably you already follow her. So let's do a deep dive. Welcome to the show.
Thank you for having me. I'm so excited.
I'm excited. And you know what? What's so exciting is that Dr. Joyce and I live very close to each other. We're in California, in Southern California. And I think I actually have a friend that goes to you, but I
Yeah,
won't reveal her name or their names because of HIPAA. But I was like, it just crossed my mind. Yes, I have friends that happen to go to you. Isn't that so crazy?
it's a small world.
It's a small, small world. Now, for our listeners who don't know you, can you briefly tell our listeners a little bit about yourself, what you do, and how you got to where you are today?
Yes, hi, mommy dentist. I'm so excited to be here. So I am a practice owner. I'm in Orange County, right down the street from Dr. Grace. And we do mostly cosmetic dentistry in my practice. I bought like this really, really old practice, which was like mostly bread and butter, and I converted it to a cosmetic practice over the years. I get most of my patients from social media, and so I'm super active on social media. It's literally the only thing that has worked for me as a business owner to gain patients, and I'm super grateful for that. And then I love posting like teeth videos, like veneer videos, and it makes the whole thing fun. I also just had a baby, so I'm around 4 months postpartum.
I love that. That's amazing. See, it just showcases that hey, moms can do it all. Moms can be leaders, moms can be business owners, and guess what? We're still momming at the end of the day, and we're doing dentistry. Now, I want to go into like what we're going to talk about, which is a lot about teeth. And so I need for you to please give a brief overview of what's called near 3D printed no prep veneers. Well, so let's talk about that first, and then we'll go to the second part of the question.
Yes, so I'm a clinical advisor for Near. Just wanted to say off the bat. Um, and it's an option that I have adopted into my practice where I have a lot of patients coming in for no prep veneers. It's if you've been online, it's kind of like the big thing right now, but specifically 3D printed veneers you've probably seen online as well. And up until recently, the only way to offer that option is to have like a Midas from Sprint Ray and print all these things in your office. Near is actually a company where they will, like, you take the scan and you send it to them and they will print it out for you. So you don't have to buy the machines, design it on Exocad, which is the whole thing in itself. And then they send it to you and then you cement them on. So I thought it'd be like a great topic for moms because I actually have a Sprint Ray in my office and I don't use it very much because I have to
Oh,
I have to run home to my kids. I'm not gonna like sit there and print things out. I thought I would. Like in an ideal world I would, but it's just been so much easier for me to bring into the practice
mm,
and actually do successfully.
mm. Wow, that's
Yeah.
so neat. So how does it differ from traditional veneers?
Yeah, so it's the material. There's traditional veneers, which is, your porcelain veneer, your feldspathic over on one end, and they're they're expensive for a
Mm,
lot of patients. They're an investment, really. So, like for upper 10 patients would be looking at like 20K plus, especially in this area. And then on the other side of the spectrum is like your composite veneer, where I don't know about you guys, but that's a lot. It it's a lot of work to do those composite veneers. And so this is meant to be like an intermediary where it doesn't last as long as your porcelain veneer. The material is about 70% porcelain and 30% composite. So it has some of the strengths of porcelain, but not projected to last quite as long.
okay.
And it's just like a nice intermediary where the
Yeah.
price is also a little bit more affordable.
Okay. So it's like a hybrid.
Yeah. Yeah.
Yeah. Yeah. I'm thinking about my hybrid golf clubs that I hate. No, I'm just kidding. No, but like, because you have to adjust, right? Like, because if you're used to doing something for so long and then trying new material, you have to practice and keep at it so that you get better at it. And so I'm just curious, when you started using Near, was there a big learning curve, or are you kind of like, hey guys, don't be scared of it. It's so easy.
Well, I do no prep veneers, like porcelain no prep veneers in my practice. So it wasn't too hard to adopt into my practice, but I think that if you're not used to delivering 10 veneers, it might be a little bit of a learning curve just because the action of delivering veneers is not an easy thing.
No.
Um, it's one of the it's one of the most stressful things that you can do in practice, like if it starts bleeding or whatnot. One of the pros of offering near is that um, you get higher case acceptance because
Mm,
they're more affordable,
yeah.
and then you can like increase your reps.
Okay.
So the idea is that these these nears, you start offering it and you get those reps in delivering, and then it
Mhm.
should enhance your porcelain practice too.
Okay. 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 So then that kind of leads me down to the next question is like, how do you differentiate, right? Like, who is a candidate for which? Obviously, because you can do it all. So it's kind of like, oh, well, you know what? For you, Grace, you're going to do the near veneers. And for you, Sally, you're going to do the other ones.
Yes. So I usually post porcelain cases. I bring most of my patients in through porcelain. And then when they come in, it really depends. Like you have to read the patient, I think.
Mhm.
Sometimes they can't afford the
Right.
porcelain cases, and so
Right.
then I'll bring up near as an option.
Okay.
Just sort of meeting the patient where they're at.
Okay.
Um, I personally, if I can read that a patient is super, super highly aesthetically oriented,
Hmm.
I'm going to push porcelain.
Okay.
Veneers they're like one material. They're 3D
Okay.
printed, so they don't
Okay.
have that same like
Right.
layering as porcelain.
Right.
So I think it's a little bit about, reading the patient and seeing like,
Yeah.
is this patient going to be okay with veneer? Because there's a different look. It's not a
Right.
bad, all my patients that have gotten veneers, they actually really, really love them.
Okay.
Um, and as somebody who like spends a lot on those lab fees,
Yes.
I'm
Yes.
like, you really like these? Like, you really like them? And then the other, like my patients that get the porcelain, they're like, oh, these are fine. And I'm like, these are beautiful.
Yes.
Like, what do
Oh
you
my God.
mean? So yeah, I've been pleasantly surprised by them.
Well, that's interesting because, because like you said, they're digitally printed. How has it changed your workflow?
The workflow is
Yeah.
similar. Um, but I think my porcelain workflow is longer. And in
Okay.
the
Yeah.
beginning, when like the 3D printed thing, that's that's a newer sort of offering in the dental space.
Hmm.
So we're in the process of really refining that to make it more
Hmm.
predictable. In
Hmm.
the beginning, people were just like scanning and putting
Hmm.
nears on just like anybody. And
Hmm. Hmm.
you can put nears on anybody, but like, should you put nears on everybody? You have to be able to see who's a good candidate for nears, who's going to look good with no prep. Some people wouldn't look good, no prep, porcelain
Hmm.
or near. So a
Hmm.
little bit of that candidate selection has to be done. Yeah.
Wow. It's so funny because when you say near, basically they just remove the two letters before veneer. They remove V and it's just near.
Yes. I was like, near?
Near, and like you're like, oh, veneer, near. Okay, got it. That's so fun. So how do tools like Smile Viz help you simulate a patient's smile and then achieve the natural looking results that everybody wants?
Okay, so SmileViz is a completely different thing than Near.
Okay.
So Near is a 3D printed veneer. So check it out. If you don't want to buy Midas or whatever, then you can just print and then
Hmm.
print through them. SmileViz is actually an AI simulator. So it's meant to help you gain case acceptance in the
Hmm.
office.
Hmm.
And compared to a lot of simulators that I've used, I've been trying out simulators for
Hmm.
years. This one actually looks really, really realistic. And it's all
Hmm.
meant to help like us do more cosmetic dentistry. And I
Hmm.
think for a long time I didn't use smile simulators because the results would actually scare patients away because it looks like
Hmm.
really crazy and unrealistic.
Hmm.
This one looks really realistic and it
Hmm.
kind of only takes 90 seconds to
Hmm.
simulate. So
Hmm.
what I do is in my office, I'll take a portrait during their consultation. And then while I'm doing my consultation, it's just going to be running. It takes 90 seconds and then I'll show it to them. There are times when I don't show it to them if I think it like doesn't look
Sure.
realistic,
Yeah.
but for the most part, it's looked pretty good.
Okay.
And it's a really good starting place for us to talk about like, oh, what do you think about this simulation? This is what you could look like. Like I've seen patients' faces just light up when they actually see the veneers on their face. It's
Mm.
such a connect for them.
Hmm. Oh my gosh. Well, of course, because now they can really, it's like trying before buying.
Yeah, yeah, yeah.
Essentially, right? Like you get to like because it's aesthetic and it's an investment and it's a lot of money. And for people kind of like with braces and ortho, right? Like this is what you look like with crooked teeth and this is what you look like with straight teeth. Like this is what you look like with your teeth now and this is what you're going to look like with a Hollywood smile. And I think people who want that smile, right? And want the veneers and they want it done in a specific way. They are more aesthetic and aesthetically driven. And it's important to them, right? Because it all affects your life. It can affect your livelihood. It could affect the way others perceive you. It affects, like, especially if your occupation is to be on TV or if your occupation is to be very public, right? The first thing they're going to invest in is their face and the biggest investment is your teeth. I mean, yeah, you can do the Botox and the fillers, but that doesn't cost as much as veneers, right? And I think you can put all the Botox in your face you want, but if you have yellow, crooked teeth, it just doesn't translate.
Yeah, I mean, it's all about helping patients see the possibilities because we can see the possibilities when we see a smile, but they can't necessarily see it. And so helping them see what is achievable through cosmetic dentistry, that's really, really powerful. And it's all about like building that confidence for them. They just show up differently after you deliver a smile. I've seen it over and
Yeah,
over again. So
yeah.
powerful.
Well, here's the thing that I want to also say. But besides the how they feel and look and possibilities, is you had mentioned before earlier, like you need to read the patient, right? You need to like walk in and read the room, the vibe, their energy, just kind of like, are they going to be a really nitpicky person? Or are they kind of like, yeah, doc, whatever you want, I trust you, you do your thing. There's a huge difference in how you're going to approach that person. So for all of our listeners who might be, um, I would say younger or less experienced with the patient conversation. Because we talked about the workflow and we talked about the material, we talked about the simulation. Let's talk about the conversation. Like, what are you saying to the patient? So let's say scenario. Let's come up with like a case scenario, a case study, or we'll role play. But you lead the way. Like, what does that look like? Give us a scenario A and then give us a scenario B. And what do you say?
a scenario A and a scenario B. Okay, well,
Yeah.
let's just simulate like what I would do in a consult, I guess.
Okay, so I'll pretend I'm the patient. Okay, I'm gonna
Okay.
come in and I'm gonna be like, Dr. Kang, I'm so excited I'm here. I've been following you on Instagram and I love all these results. And here's my phone and see this person that you did a video. I want that exact same thing. I want that.
I get that a lot. I also get Margot Robbie. I want that.
Mm-hmm.
So that consultation is going to take me so much longer because I have to put their face up on the screen and show them like this is this is what's possible for your face. It's not going to be that, but we
Mm-hmm.
can take characteristics of her smile and put it into yours. Yeah, that one's a little bit of a harder conversation because people think that you can just copy and paste people's teeth onto the face. And you know, we all know like different colors of teeth look different on different skin tones, so we have to talk about skin tone, like what would look good on you. I always take that patient back out of like here's the inspo and go back to like here's what I think would look good on you. And
Right.
then we start with that as a base because ultimately these patients don't come to you for the veneer. They come to you for your expertise and your eye and what you think would look good on them and what you're able to predictably deliver on them. And then from there, we start a real conversation. Not if they're really stuck on like copy and pasting this person's teeth, and I don't think it's possible, that that's not we can't get started. I'll be pulling my hair out.
Oh, absolutely. Yeah. It's tough. Okay, so I'm gonna come up with another scenario.
Yeah.
All right. Okay. So what if I come in and I'm like, "Hi, Dr. Kong. I've been your patient for like 10 years and I really like my smile, but I really don't want veneers. And I don't really want braces, but my teeth have get starting to shift. But what should I do?"
It depends how much it shifted. So I always start these conversations saying, we can veneer everyone, but our goal today is to make a plan for you that is specific to you, that's going to address your needs in the most conservative fashion. And then we'll talk about all your options and figure out what's the best for you. And then if alignment is one of those things and the teeth are not aligned, even if they don't really want to do Invisalign, we are still, for me, I think I'm still going to push the Invisalign. If it's one of those things where we can skip the Invisalign because the teeth are relatively still straight, then we can talk about composite bonding as an option. I do a lot of bonding in the office, and I I think it's totally fine to have stepwise treatment plans where if they're not ready for veneers, we can do things in composite first as long as they realize it's maybe not going to last as long, but it gives them a good visual on like what it can look like when it's just all dialed in a little bit more. With composite, it's so powerful too. Just dialing in the smile just a little bit with a little bit of like Bondo. And then once they see that and they're happy with that, they feel that like little surge of confidence, it's been time for them to replace it, then they can go maybe open the door to veneers later.
Okay. All right. Well, those are scenario A and B. My next question to you is what equipment in your office that you love so much you can't live without?
Equipment?
Yeah.
Oh,
Toys. What toys can you not like? You're like, I can't live without this toy.
oh, well, I think the smile simulation thing is actually, when I started using it, the case conversion went up so much. So that I cannot live without. I actually really love my STA. Um, that's like the anesthetic
Yeah, the single tooth
wand thing.
anesthesia. Yeah, the wand.
I've been using that for like 10 years, and if it broke, I would buy another one immediately. It's just part of my workflow. Patients I thought when I started using it, patients would be like, oh my God, the injections are so painless. But actually, they don't say that. They don't even acknowledge it at all. But it's great because it adds to the patient experience. So when I'm doing veneers, if I can start off the whole procedure without hurting them,
Yep.
so much smoother throughout the entire thing.
Okay.
I love
Okay.
it.
Anything else?
I use my iTero every day.
Okay.
I love it. I I don't think I use enough of the features. Like all these little features, like the Neary and stuff, I thought I would really use all the time, but I don't. But
Mhm.
the thing I do love is being able to overlap all of the
Yeah.
scans over time and
Yeah.
seeing the change. It helps me to be a more conservative dentist for the patients that are in like the bread and butter section of my
Yep.
practice.
Yep.
And I scan all my veneers. It's just, I can't live without that.
Okay. Amazing. All right. So now I just have to, pick your brain on little things. And now we're going to shift into the social media part. What tips do you have for dentists who want to grow their social media presence, but they're like, it's very overwhelming?
It is overwhelming. I totally understand that. And social media is my favorite thing in the world. I can relate because my husband just did a startup like a month or two ago. So we have a newborn, we have a startup. It's been crazy over here. And he is like exactly the type of person where he hates social media. And
Mm,
he's like, God, I gotta do the social media. I've shouted him out a few times, and he's gotten his first like set of patients from my social media. So he
okay.
got to see the power of it.
Okay.
But remember that my social media has been built over like 7 years.
Yes.
So my advice for people who are starting is um, a couple of things. Like you just have to start making something because you're not going to be very good at it in the beginning. And I wasn't either. I was not comfortable being on camera. I wasn't comfortable talking to the camera. And it's like, what do you call it? Exposure therapy. You just keep doing it, keep
Mm-hmm.
showing up,
Hmm.
and that's how you're going to start refine what types of content you're going to make.
Hmm.
Um, I also have been talking to my husband about like who exactly is the type of patient that you want,
Right.
because if you can nail that down, you have a better idea of how you're going to make that what type of content they want to see. Like my
Absolutely.
content is very much geared towards women, and because I make my content for women, my analytics say that my Instagram followers are, it's like over 80% women. So it's not about just like gaining followers, it's about growing an audience of people that 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 is extremely, extremely targeted.
I agree 100%. And I think that for people who are listening, you can use Instagram, you can use whatever platform you want to use, like whether it's TikTok, Facebook, YouTube, whatever. It needs to be something that you have to be consistent because if I have anything to say, Joyce, is that you're consistent, right? It doesn't have to be a polished video that's edited with high style, like some other dentists that we follow have like it's a style, right? And it's got to be your style and it has to be authentic to you and what you want to put out there, but you show up. It's not like you put up something and then wait like a month later to put something else up. Like you show up consistently. And I think, like you said in the beginning, you may not like looking at yourself. You may not even like the way you sound. And it's going to be sloppy, but that's okay because that's what people like. They want to see the real you, right?
I have shown up consistently since 2018. Consistency for me, you self-define consistency, at least minimum once a week posting.
Yeah.
And I pretty much show up every day on my stories. And that's over 7 years. I've never missed a week of posting, even through like the postpartum haze.
That's
So I
incredible.
like batched content getting ready for this,
Yeah.
to have this baby, because consistency is actually part of my brand. I show
Yes.
up.
You show up. Exactly. And that's why I want to say that because it's your strength. It's what people want to see. And like I think that that's what makes you real and then relatable and trustworthy. Because I think what social media, I want to say it's not always about trying to get patients, right? It's about the trust. And when
Hmm.
you are consistent, they trust you more. And, eventually they'll become patient or something else. But again, you do that so well. You show up, and therefore it turns into developing trust, even if they don't know you personally.
Yeah, it's such a great way to build trust at scale, I I love being on social media. I think it's like super, super fun, but I think when it comes to the way that I show up, that makes it easier for me to show up is that I know who I am. And this didn't happen overnight. It's actually seeing yourself on social media helps you to figure out and become
Hmm.
more self-aware. Who
Hmm.
am I? Because branding, I think part of that is just like it's actually an act of self-exploration more than
Yeah,
projecting a certain image.
right.
And I think that because I've been doing it for a long time now, I know who I am and I just show up the way that I want to show up. And my content, I also sometimes wish it was like a little bit more fancy, but in the reality of my life, I'm not going to be able to show up the way that I need to if I make it too fancy. Like if I
Oh,
create those
absolutely.
barriers.
Yeah, yeah. And it's like sometimes, again, you attract the people that you want to attract. But I think that when you show your work, when you show the teeth, when you show the experience, and it's like the behind the scenes, right? When you show the behind the scenes, I think people then start to like develop the trust. But then they walk into the office and they're like, "Oh, I saw this on your video," or "I saw," or your front desk person was, like they recognize parts, right? So then immediately when they walk in, it's like they feel comfortable because they feel like they've already been there.
Yeah, they're always like, "How's Harper?" It's so
Yeah.
fun.
Yeah, it is fun. And you have to have a willingness to share, right? Like you have to be willing to share some parts. And of course, there are parts of your life that are private, not to be seen, but you are willing to share. And I think that you have to be willing to share.
Yeah, I think, social media is not going to be for everyone. I think everyone should like have some sort of presence, whether you're going to be this to my extreme or not. Just because patients do like cross-check certain things, but it's not everyone. What I do, I think, is more along the lines of like I'm growing a separate brand on top of just promoting my practice. And so when people try to like do what I'm doing, I don't think you need to do it at this level. This is not what you need just for building a practice.
Yeah, right, right, right. Like the clarification is that you don't have to, you create your online presence the way you want to create it. And obviously you love it and it shows and you have so much fun and it shows and it brings everybody on an experience with you. I mean, and then for those of you who are listening, you're like, um, I think I just only want to do X percent. And that's okay too, right? Because at the end, it's all about your objectives. Like, what is your objective? Why are you using this tool? What purpose does it serve you? And so I think what is so crazy 7, 8 years ago is the social media world. I mean, maybe even 10 years ago, it was just starting, but it was really meant for connection. It was really meant for like, this is my friend from, grade school that I haven't seen in
Uh-huh.
like 10 years. And now look at how we're using it, right? Like it's such a powerful tool for everyone to use. You just have to find the right one that works for you.
I think that's how I started too. Like I didn't start thinking, "Oh, this is a great marketing tool."
Right. Yeah. Yeah. Right. Like
I
it,
was just
it
sharing.
totally. And then it became that way. And I just think it's so, so awesome. And you do such an amazing job and you make it
Thank
fun.
you.
And it's nice to see all the like things that you're doing. And yeah, so keep up the good work. All of
Thank
our
you.
listeners, go give Dr. Kang a follow, go watch and get inspired. And then my last question, because you're a mom, is what's your number one piece of advice for maintaining balance between your professional and personal life?
I don't think I'm like a balanced person, like at all in anything I do. I actually really like being kind of out of balance. It's just like I love that feeling, actually. It's weird, but I think when it comes to the mommy life, it's like seasons. Like I just took 3 months off for my maternity leave where I shut down the practice, which most people cannot do because it's a two-chair practice, so I'm able to. I kept I kept paying all of my employees. They just sat there. I sh They didn't even contact me, probably like maybe once or twice in that 3 months.
Mm-hmm.
But that was a season that I gave to
Mm-hmm.
myself. That wasn't for my career. And there's a part of me that sort of you mourn it because it's your career is so important to you. And I was like, I'm
Mm-hmm.
shutting this down to sacrifice. But
Mm-hmm.
also, I knew I wanted to be present for this newborn. I tried so hard to make this newborn. I went through
Yes,
IVF. I
yes,
did this whole thing. I'm like,
yes,
I'm going to treasure this newborn. This is
yes,
my last kid. Like
yes.
this is so important to me. So I just blocked off the time and I did that. And then
Good for
now
you.
I'm in the season of like, okay, I drained my bank account over the last 3 months. I need
Yeah,
to work again.
yeah,
Like so
yeah.
now I'm in the season of working. And I think like I always do prioritize right now based off of the my kids' needs and
Absolutely.
where I want to be. For me, kids are still more important, but
Mm-hmm.
I realize I can't give up my career. It's just not how
Mm-hmm.
I'm wired. When I went back to
Absolutely.
work, I was so happy to go back to work, and I know some people
Yes.
are really unhappy. I still cry on that first day every time I
Yeah.
drive back to the work after having, you know, actually every time. It's not like the first time I cried. This time I was more prepared, but I need both, and I know that. So I prioritize the kids, but I also incorporate the career part, and then I
Absolutely.
work in the seasons as they need it, like flexibly.
Absolutely. You know what? It's ebbs and flows. That's how life is, cyclical, and you just have to choose, right? Choose what you want to do and stick with it. And I love it. I can relate to you about not being very balanced. I think most of us aren't, and that's okay because we thrive in it. We thrive
Yes,
in
it's like
this
an energy.
energy. Absolutely. And for people who are listening and laughing, that means you are the same. So thank you again for joining us. And I'm so excited to have you on. We need to get together for lunch. You're just down the street. It's funny because I moved here 5 years ago and I still feel like I haven't done my part in like really like connecting with everyone here because I travel. I'm on a plane like once a month and I'm like always out doing mommy dentist stuff and lecturing and this and that. And I'm like, I have to get all my Orange County moms together. So that is my next thing is we're all getting together and I'm going to not take no for an answer. So here we go. Listeners, again, thank you for being with us. I just want to say our next event is our CEO Roundtable. That's in Nashville, end of April, early May. That is sold out, but we have another event coming up in July. And again, our social summit, but we only have 10 seats left. So if you guys really want to experience anything MDibs related, go to our website at mommydibs.com, become an official member. All of the resources that we've put together are for you. It's for the mom. It's for all of you who can't travel. Inside the portal, we have a load of live, like a huge over 200 hours of online CE that you can do while you're nursing or pumping or in your pajamas drinking wine from home. So I know you're all busy, but take a look and we will see you there. Thank you again, Dr. Joyce, for being with us and sharing a little bit about your workflow and your personal life. We are so honored to have you. Have a wonderful day, everyone. Take care.